Alrighty, good afternoon, and thank you everyone for joining us on our July 13th Lucas County COVID-19 briefing. We have quite a few different items we'd like to go over today, all relating to COVID-19 in our community. So I am going to turn it over to our Health Commissioner, Dr. Eric Skidzinski, to give an update as to what we're seeing here in our local community. Thank you.
Thanks, Shannon. Welcome, everybody. I'd like to start off by talking about schools. We've been working with the local school systems for at least the last 2 months on reopening in the fall. And those plans are not only intricate, but they're also very complex in the sense of what is going to be needed. The thing that I like to make sure that we stress is that we are going to have some sort of school in the fall, and that we always deal with this, and that's getting our kids vaccinated before they go back to school. So want to make sure that, again, the word gets out that let's get vaccinated, let's get those kids vaccinated before they go back to school, so we're not in a rush like we always are every year. So again, getting kids vaccinated, going back to school is really important, since we are going to have some sort of school starting off in the next month and a half or so. So with that said, let's talk about what's going on locally. We've been talking about an increase in COVID cases, and I will tell you that over the last week, we've had a very large amount of COVID cases coming in through the labs, and so we're seeing a lot of positives. And over the weekend, we actually probably saw a little over 150 cases come in. That pertain to later on in the week of testing, but then also some lagging tests. So we know that a lot of people are getting tested because, again, those tests are starting to lag again, like they kind of were at the beginning, but not as bad for the most part. What does this all mean? This means that we are seeing more cases. There's more community spread. The age group that we're looking at is 56 or so percent of the new cases that are coming in are really that 18 to 30-year-olds, and that's important. Shannon, do you have a slide that we might be able to pull up on that graphic? So if you take a look, when we're actually looking at our data, you can kind of see that 18 to 24 to and then 35 to 32. You look at the red bar. You definitely see that is our major concern right now with age groups. It's actually flipped from what we saw back in March and April. If you take a look at that 55 to 65 plus, so we definitely see now that those younger individuals are presenting with positives. What does that mean? That means, again, as we've talked about, that younger age group is out and about. Again, we can look at going out to restaurants, but they're actually going back to work. That's a prime age group for that, and they're socializing more. So that is a concern that we need to address. Again, this is community spread, and we have to make sure that we understand that we as individuals need to take it upon ourselves to limit the amount of ability for this virus to spread in the community. How do we do that? Again, the things we've talked about, but I can't stress it enough. We really shouldn't be going out as much as we would like to. Again, I want us to go out. I want us to go out to the restaurants to if you would enjoy life. But again, if you see the restaurant you're walking into is packed, turn around, go someplace else. Wash your hands. If you're sick, stay at home. Avoid those large crowds as much as possible. And then, of course, wear the mask and the face covering. I know that is still a gutter reaction for a lot of individuals who don't want to wear the mask, but we know that it does cut down on the amount of infection from this disease from person to person. So again, that is important. It's important because we've heard in the state, many of our counties now are red, which means a mandatory mask use. Again, this is one tool that needs to be used to be able to decrease that ability for this virus to jump from person to person, along with the social distancing, along with the washing of hands, along with the staying at home, all the things we talked about. But again, we have to take it upon ourselves to do those things. If we're not going to do those things, you're going to see these cases rise. We've unfortunately have had over the weekend some discussions with individuals who, again, knew they were sick, went out, and now we're looking at those individuals possibly have again got individuals sick that they didn't need to because they knew they were ill and or positive, yet they decided that they wanted to go out and do something. Again, that is a concern, and we need to address that in the sense that if you are quarantined, if you're isolated, if you're not feeling good, if you don't think you should go out, please just stay at home. Just make sure that you don't give this virus the ability from spread to person. The mask ordinance. Let's talk just a little bit about that. As you know, it's scheduled to be on the council's agenda for Tuesday. And again, if you've been able to take a look at the draft ordinance, it does do what it's supposed to do. Again, it gives us the ability to have outs for the mask. If you have the ability to wear one, it's very important. But again, if you can't because you have some sort of condition, under 6, if you're working out, if you're at the dentist, I mean, it has some very logical things where you shouldn't be wearing a mask. But if you're out and about and you're going to be near people, again, we really want that mask to be used. And again, the council will take that up, and we'll see how that vote actually goes tomorrow. A little bit about follow-up with cases. We talked a little bit about Put-in-Bay a few weeks ago, and the concerns that we had there, and the number of individuals that were positive residents that had a connection to Put-in-Bay. Well, actually, now that has grown from not only those individuals that we knew were at Put-in-Bay and were positive, but now we can actually link 16 more residents to those cases from Put-in-Bay. So again, I want to make sure that the community understands how this works. Individual gets sick someplace else, they bring it back into the community, into their homes, and next thing you know, other individuals are going to then become sick as well too. Same thing here with Put-in-Bay. I'm not just focusing on Put-in-Bay because again, this happens everywhere now. When you're going out to restaurants and bars and other large events, we're seeing the same thing. So again, it's just an example to use that this does happen in the community. And we really need to take it upon ourselves to make sure we're doing the things as individuals to not spread this. And I can't stress that enough. The other thing that I'd like to talk about is the idea of being in large groups. We've talked about this so much, but I really want to stress this one more time. When you're going into a large group, you need to, or actually anywhere, you need to think about this as the individual next to me has COVID. That's the best way to think about this. Because if you think of it that way, you're going to take precautions for yourself, but then also taking precautions for others in that facility as well. We had a funeral here recently where individuals were sick, and we actually had to go back and look at what was going on in there. And that's why contact tracing is so important. What was going on at that funeral, and it was finally decided after contacting the Department of Health and several discussions that really what we needed to do was anybody who was at that funeral for longer than 15 minutes really should need to be quarantined. And again, contact your doctor if there's any issues with symptoms, you want to get tested. Again, that's important if you feel you need to be tested. But please remember, when you need to get tested, there is some lag time here. So you have to have enough of virus in your body for that test to actually pick that up. So again, just because you were exposed to somebody one day, you're really not going to have any legitimacy of getting a positive or negative if you go out the very next day and test. So I just wanted to kind of bring us all together and have a discussion about what's going on in the community. But the big thing I really do want to discuss is the cases since July 1st. We have had almost 500 cases, positive cases of COVID inside of our community since July 1st. That's a substantial amount. As you understand too, that the governor is looking at a bunch of different criteria, but one is the number of cases per capita. So again, I am urging everybody, if we want to make sure that, we're not mandated to do things such as wearing a mask, and or possibly if we move into a situation where the governor might have to come back and say, you need to start curtailing some of the activities. We really need to take it upon ourselves to stem the tide of the disease. I know that one last point, I know I've also gotten a lot of emails thanking the health department and others for doing the job they do, but we've also gotten some emails, again, bringing up points and would like to start some dialogue, is that, the death rate is not that big, the fatality rate is not that big for this disease, so, why are we so concerned? I'll leave you with this. What happens if that was one of your loved ones who passed away from COVID? That would be devastating. So when we make the comment, well, the fatality rate isn't that great, it's great for some families, it's great for individuals who, have somebody who they knew passed away, as I think we've seen in the media over the last couple of days with some younger individuals who passed away and telling of their story and what they wish they would have done differently. So with that said, Shannon, I don't think there is anything else that we wanted to really talk about. Do you want to open up for questions?
Sure, Eric. Are there any questions, comments by local media? If you do, please unmute yourself. Amy, go ahead.
Hi. So I know we've talked about the Toledo mask mandate. Do you think at this point Lucas County needs one? And Wood County obviously has one because it is a red county. Is that something that we think may happen or that Lucas County needs?
Again, I think if we continue down the path, and if we look at the other counties that have already went red before us, we always lag a couple weeks behind. Whether it's the number of cases versus hospitalizations versus fatalities. If we look at some of the other counties, we're seeing what's going on there. My point of view has always been trying to make sure that the community members do what's right, so that we can stay ahead of any mandates, so we can stay ahead of large increases in cases. Again, we've talked about this so many times, and we'll continue to talk about this. It's so important to follow those things that we need to make sure we don't spread the disease. But again, masks, face coverings, they do prevent that spread. Not 100%, but they do prevent that spread enough so that we could probably get a handle on the cases that are out there, so that they do come down. I would like to see us countywide do it. But again, we're starting with Toledo. Toledo wants to take that up, and then we'll see how that then can venture out to the rest of the community.
Do you think having a Toledo mask mandate would lower case numbers specifically for young people?
Again, I think we got to understand mask use is extremely important. I mean, there's research out there where, again, and just logically, if it stops your saliva from coming out, which the virus, is attached to, if you would, and getting into somebody else, it makes logical sense. There's also research out there which states that it does work with specific masks and things of that nature. But again, the main purpose is the use of that mask. If we do start using that, but coupled with that 6 foot distance, stay home as much as we possibly can, but again, still go out and understand we have to do things. Watching ourselves if we get sick to make sure that we stay at home as well too. So if we couple all those things together, yes. And that's kind of, if you look at what we did with the quarantine, when we shut everything down, that's kind of what we did. We stopped all this from happening. We saw that, our numbers were high and then they came down. The same thing's going to happen, maybe not to the degree we would like to see if we were all quarantined, but at least to a degree where we can exist with the virus. And I think that's what we need to do. We need to learn how to exist with the virus at this point in time until we can find a vaccine.
Okay. A lot of restaurants, we're seeing some posts that, they had an employee test positive, so they kind of closed down for a couple of days. I guess any advice for people who may be going to those restaurants, or who may, restaurants who are kind of wondering what to do at that point? What is the kind of protocol there?
Again, I hate to keep on harping on the face covering use, but again, if everybody's wearing face coverings in there and trying to stay that 6 foot apart, you're really seriously going to limit that ability for that virus to get from person to person. So again, I think it goes back to, employers making sure that their employees are taking every precaution they possibly can, not only in the front of the house, if you would, by serving customers, but also in the back of the house. You could say 6 foot away from every patron, but then you get in the back and, you're within 6 foot, you got your mask down below your chin. So again, you need, unfortunately, you need to be diligent with all this. The other thing then too is we're going to have cases that there's no two ways around it. Everybody, probably every facility at some point in time is going to have at least one case that they're going to have to deal with. And you deal with that by, again, taking a deep breath, understanding that the virus is here. Go ahead and do what you need to do relative to quarantining. You make sure that, we're called if you have any questions. We'll help walk you through what you need to do. But it really is getting those individuals quarantined so they're not infecting anybody else or your employees, and then doing a cleaning. That cleaning does help. And again, those are probably the best things we can offer to businesses right now.
Okay, I'm good for now.
Thanks.
Mel, go ahead with your question.
Hi, Eric. Melissa H. from 13. You alluded to the fact that we've had cases where people knew they were sick and infected, yet went out and infected others. Can you be more descriptive of what happened there and use, can you?
Well, again, this is relatively unique because we haven't heard too much about this, but over the last 2 weeks or so, we've had some issues with individuals who either knew they were sick and maybe they were exposed to a family member and going out and not adhering to quarantine guidelines. That's a real concern. And the reason being is that you actually are taking that chance, if you're exposed, to actually expose somebody else and cause great illness or worse. So I want to make sure that people truly understand when we call and we say you need to be quarantined or you need to be isolated, you have a disease, quarantine, you were exposed, that you stay there and do what's asked of you for those 14 days. Again, that time frame that we're asking to stay in. It does nobody any good to go out and get somebody else ill, because then that just continues to perpetuate. I got to admit that for the vast majority, they've been very good with quarantining and making sure that they're staying at home and doing those things. It's just that we cannot allow individuals to venture out if they know that they're sick.
All right. My next question is, how close are we to going to level red based on the criteria per capita and our numbers? I mean, are we going to, they announced it on Thursday. At the rate we're going, do you think we're going to go there sooner rather than later?
I think, again, we know the numbers of the hospitals. I think that's that criteria too. How many admits do you have the hospital? What's your outpatient percentages? How many ICU beds are being used? So there's some criteria too that we're flirting with, if you would, to see go up. It all depends, again, how, since it is new, how these risks are actually evaluated, each of these categories, and do they put more weight on one or the other? I will say that we're trending really the wrong way for the number of cases. Thank goodness that, again, we're not seeing any real fatalities at this point in time. But again, like I said before, we need to look at 2 weeks ahead of time, or look at other individuals, other counties, because we're lagging about 2 weeks behind what they're doing. So what's happening in Cuyahoga County, what's happening in Franklin County, what are their rates and how do they look? So again, if I was just looking at guessing, we're probably going to approach red at some point in time over the next 2 weeks. I'm not so sure it's going to be this week.
Let's talk about testing availability. I know that you and I have spoken about this. It's been very, very tough to get tested locally. Where do we stand on the possibility of adding more testing sites?
We had a discussion this morning about a site that looks like they're coming online. They're already doing some testing, but again, we need to make sure that we can go ahead and put them on the website. But again, that's additional testing. I know here at the department too, we're looking at how to help out as well. So we're going to be looking at, we've already trained staff. We're trying to, again, look at logistics and safety procedures and how do we help, alleviate some of the burden as well too in the community. So there is additional means that we're going to bring to the table that hopefully alleviate this concern with the test. But again, it's just not us. This is happening throughout the state where there are cases that,
Oh, yeah.
everybody wants to get tested now, which is great, Probably what we need. But again, they're inundating not only the testing sites, but then the labs as well too.
And finally, you spoke of schools, and that's been an issue that we have seen a lot of national coverage on. We have some schools going back on a graduated scale or an alternating scale, sort of a blended schedule.
Mhm.
So other schools going back full time. I know that superintendents and heads of school have been working very closely with you, but what is the actual recommendation from a health perspective on bringing kids back full time all 5 days a week?
Again, having these discussions with every school system, every school system a little bit different. So their plans, I think, in totality, kind of mirror a little bit of what everybody else is doing, but each one's going to be a little bit different. Again, there are some schools out there that we can get the separation. They can look at the class sizes, so that's not going to be a concern. Where other ones, might have some issues with 6 foot separation. So again, they're trying to figure that out. Again, the mask use is going to be big. I will tell you, several weeks ago, we've had discussions that, mask use was going to be hard, but I think as we see these numbers starting to increase, the issue of trying to get back to school, we have to employ every tool we possibly can. So I think people are really starting to buy more into the face covering use in the school system. But again, there are so many variables, there's so many different things that happen in a school that people don't realize, from changing of classes to, how are they going to actually get cafeteria time, recess. There's a lot of things that go in this planning. And I will admit that our superintendents are fantastic, and that they've taken a very proactive approach to making sure that we're going to be as safe as we possibly can.
All right, thank you.
Sure.
Liz, go ahead and ask your question.
Hey, it's Liz Scalker from The Blade. I'm curious, we talked so much about modeling and projections at the beginning of this. And once we kind of got through our April peak, we haven't really heard much about what we're expecting for the coming months. Are you seeing any projections for where the state and the county might be in the next few weeks or even the rest of the year? Because I feel like we don't really have a sense right now of where we're going with this.
Liz, I will agree with you in the sense that we talked so much about modeling at the beginning, and there were so many different models that people were using. I don't think that there's a standard model out there that ODH is looking at. I think what they're doing too is modeling after actually what's happening. If you kind of look at Florida, if you look at some of the other states that are really having some issues, again, I think everybody's looking at those going, we don't want that to happen in Ohio. So what do we do? And I think what the governor did with the risk categories, again, going to red, mandatory mask use, I would imagine if you go to purple, you're going to hear other things. Again, I don't have an insight into that. So I think the modeling itself, I guess you could say, is what's actually happening in real life, and how do we make sure that that doesn't happen here. Every night I get home from work, and I get on the computer and I start looking at what's happening, throughout the United States. But then, John Hopkins has a great site. There's some other sites out there, and trying to figure out exactly what's going on. So again, we can make some informed decisions here locally with the understanding that ODH, kind of does drive the bus overall. But again, we can make decisions here locally because of what we see with other communities, with other counties, with other states.
Do you think it's useful to have projections? Do you think at the end of the day, it helped us to see those numbers early on?
Again, I think modeling is needed. And the modeling that was used at the beginning, I think would have been really more, I don't want to say, I guess would be more accurate in the sense if we didn't do the things that we were doing to help stop the spread of the virus. So again, I think modeling is good, but you have to look too at the basis for that modeling. Does it change over time? Do the needs for the inputs and how you look at the inputs, are they actually changed inside that modeling so they take account for those? So again, modeling isn't perfect, but again, it gives us a pretty good idea of where we might go.
Thank you.
Sure.
Bree, go ahead and ask your questions.
Hey, Eric, it's Bree with 24. You talked about hospitalization, so I just wanted to touch on that again and just see what is it looking like with that? Are we increasing on hospitalizations as we see these increase in cases as well, or what's the status of that?
Sure. You know, the hospital systems here are just, they're fantastic, and they are in communication all the time. And what we're seeing, again, yeah, don't take, hopefully the viewers don't take this the wrong way, but we do. We see little upticks and down, upticks and down. What we're seeing right now is maybe a little bit more of a little bit of an uptick for some hospitals, but nothing that I think you would be concerned with. I'm concerned with that because anytime we see upticks in a hospital, being, you know, the health commissioner, you know, I got to look at that. What's happening? Where is this going to take us? But it just can't be looking at one day. You kind of got to look at a multitude of days. And I think that goes back to the risk categories the governor is using. It's not just looking at one day, it's looking at, you know, 5 days or, you know, again, other time frames to see where we go.
And then follow up to that, contact tracing, obviously now we have this traced back to the community spread there. Is this something that's just coming from when you do the interviews, you say, hey, you know, you should have been quarantined for this much time. Now you've gone to place A, B, C, and D. Now we have to follow up and kind of check in with that. Are we seeing any new developments with the contact tracing?
I think what we're seeing is a large amount of additional contact tracing that we weren't doing, you know, a month or so ago. Again, we had, if you would, that lull, and, you know, allowed us to get caught up. And to this, you know, when we started this too, remember, we kind of shut down really quick, so you didn't have all this community spread, but now we do. So we're seeing an increase in numbers. Again, from my standpoint, you know, I want to make sure we're always ahead of the curve for this community. So we're also looking at, we're probably going to bring in some other contact tracers from the community. So we're going to do a hybrid approach with UT, internal staff, and maybe some external, just because, you know, if we start moving into even more increased numbers in the fall, which we could because we go back to school, we really need to prepare now for what's going to happen in a month or two.
And then just lastly, we had talked previously last week just about, you know, what could it look like for scaling things back? Could we see some stuff start shutting down again? What's your updated response to that?
Again, I've gotten nothing from the Ohio Department of Health or from the governor's office that, you know, that's going to happen. I can surmise, though, if we're put in a position where, again, we start seeing cases with fatalities, you know, again, I would think that we would have to take a really long, hard look at what we're doing and what we can scale back. But again, I think what the governor is looking at doing is doing it county by county. So again, just because we may not be in a severe amount of trouble, but another county is right next to us, we could still operate where they may have to scale back. So again, I think that's the right thing to do, because you just don't implode the entire economy again.
Perfect. Thank you.
Hi, Eric. It's Emily from the Blade. I just wanted to add a follow-up question to a previous question about coronavirus tests. So has the sort of past month of increasing coronavirus cases affected how long individuals have to wait to receive their test results? And if so, do you have a sense of how long that time is?
Sure. You know, again, it's not a hard and steadfast role right now of returns, but, you know, we were seeing 24 hours, you know, a couple of weeks ago, if you would. You know, we could be seeing 48, maybe 4 days. There's one individual that, again, received, this is the story that I got, just received theirs. It was like 8 days. They were negative, but they just received it. So again, I think we're seeing that same issue with labs being inundated, and then, you know, getting us results. Now, there are other labs out there that are still doing 24. It just depends on where that test is coming from.
And on a related note, have you seen any kind of limited access to like hospital beds or difficulty entering hospitals?
No, not at this time. We just had a conference call with hospitals this morning, and that is not an issue at this point in time.
And is there a projected possible shortage of the number of coronavirus tests available to patients or patients seeking tests?
You know, I heard some rumors last week about some media shortage. I haven't heard anything since last week on that.
Mhm.
I know that all of our sites that are actually testing right now are filled up with appointments. So they haven't turned anybody away for lack of media or test equipment.
With regards to the mask mandate on the table for tomorrow, do you have a sense of whether the mask mandate will be enforced by the Toledo-Lucas County Health Department or the police department?
Right now, so, again, the draft that's out there, it's
Mhm.
actually the police department and as well as the health department.
So together,
Yeah, yes.
okay. And do you know if this will be like an active enforcement or like complaint based?
You know, again, I don't want to say too much right now because we don't know how it's actually going to end up. I will tell you from the health department's perspective, it's really important to make sure that, again, the businesses understand what they need to do. So I know that I really want to be able to, if this does pass, to help the businesses out with what they need to have at their fingertips to be able to make sure that they implement this. What are the barriers? How can we help them? Because again, if you look at the biggest bang for the buck, if you would, if we can get into those areas that we've had complaints with, that people aren't wearing face coverings, like bars or restaurants or things of that nature, we're going to be able then to expand the ability for us to, contain the virus at each time we have more people actually wearing that face covering. The individual on the sidewalk. Again, we really want them to wear that face covering if they're going to come in contact with people. But again, right now, the idea, at least from the public health perspective, is where can we make the biggest impact the first couple weeks that this is actually being, if it does pass, is actually being in effect.
Great, thank you so much.
Eric, it's Melissa again. I'm sorry. Can I just ask a quick question, Shannon?
Sure, go ahead.
Yeah, I want to go a little bit further down that road. What is your reaction to the ordinance? Do you think it's strong enough? Do you like it? Do you like the enforcement part of it? What's your response to it?
Melissa, good question. I'm going to start off by, do I like the enforcement part of it? No, I mean, I really wish we wouldn't have to enforce anything. So that to me is a little bit tough. I was hoping that we would be able to go down the route where people just would wear face coverings, but I understand. So with any ordinance, you have to be able to enforce it. So again, that's in there, and it is what it is. Overall, I think it really does hit on the things we needed to do. There are, if you would, exclusions to wear face coverings, which we need. I mean, we've talked about it to nauseam sometimes about when you should be wearing a face covering and when you shouldn't. So it's in there. And again, we're taking a stance to say that this is important for our community. If we want to make sure that we don't go down a path where we might have to curtail some services, whether that's in the restaurant industry or in industry in general, because we've went too far down the risk categories and now we have to do something about it. Let's be proactive and actually help stem the tide now so we don't have to do it later.
Thank you.
Sure.
We had a question from a viewer asking what the business's responsibility as far as notifying employees of a possible exposure and what their procedure is, and if there's a minimum that has to be done within the establishment.
A good question. Now, remember, this is an infectious disease of somebody. So if I have it, we just can't say that, to everybody, Eric has X disease. Or COVID in this case. So we have to walk a little bit of a tightrope. But again, since I'm working here, now somebody here is going to call the department and say, okay, where has Eric been? Who has he been in contact with? You got to make sure again that you sanitize his area. So again, that's what we would be talking to an employer about. because again, we need to do that contact tracing. So we are going to have the discussions about those individuals with those individuals with their employer, just to make sure that, again, we're getting all the information and they know that they have to clean. Because again, think about it as a large factory. You don't want to clean the entire factory if, you know, that individual was only in one segment or one section. Shannon, does that answer the question? I'm sorry. And I apologize for the phone ring.
Yes, that's fine. Thank you. Okay, I believe that is all of the questions that we have for today. If anybody else has one, please go ahead and type it in or unmute yourself and ask your question. All righty, I think that'll be it. If there are any other questions, we can follow up with them on an individual basis. Thank you all for joining us today.
Thanks, Shannon. Thank you, everybody. Take care.